Well, a warm welcome to this talk. It's Wednesday evening, still the 15th of December. Now, there's been some very confusing, to be quite honest, confusing coverage in the mainstream media about what's going on in South Africa. So I wanted to clarify it, given the data that we have actually from South Africa itself. So important because where South Africa is now, the UK is following over the next 2 to 3 weeks. The United States will be following after that, and by extension, the rest of the world will be following at various paces after the South Africa example. Now, here we see the situation. Now, India and Japan, thankfully, very low cases. That's good. Canada, they're going up slightly. Now, this is the Omicron surge in South Africa. But if you look at relative number of cases, it's only up to where the United States is now. Now, South Africa will be carrying on increasing. There's no question about that. But this is Delta in the United States and Omicron in South Africa. And the United Kingdom, where we've actually got a bit of both at the moment, well, we see cases dramatically increasing with a record number of new cases reported today, actually, for the 15th. New weekly hospital admissions, United States already high, Delta-driven. These are Delta-based hospital admissions in the States. United Kingdom, again, these hospitalisations are virtually entirely Delta, virtually entirely. South Africa, they're virtually entirely, well, they probably are now entirely Omicron. So we see much lower levels on the Omicron South Africa data compared to the United Kingdom. And we see in South Africa that Omicron is now 98%. Now, this is such an important slide because what this means is the Omicron has displaced the Delta. It's not as well as, it's instead of. Delta is now finished, basically, in South Africa. Omicron has displaced it, completely taken over, and that's a very important point to note. Canada, Japan, these cases are increasing, of course. India, we don't really have full data. The United Kingdom, Omicron's much higher than that now. And the United States, it's probably a bit higher than that now as well. Now, let's go on and look at some data from South Africa now, some information. That's the Our World in Data reference up there. Do check it out. It's so interesting and so well designed, that website. Cases in South Africa, 26,000. So compared to the 86,000, was it 85,000 in the UK? Still quite a bit lower, but we do know that they are on an upward trajectory. Will increase for the next few weeks. Positivity rate, so 32.2% of tests are coming back positive in South Africa. And of course, this means there is an awful lot of community transmission in South Africa. Basically, everyone in South Africa is being exposed to this. These are very, very high test positivity rates. Deaths in South Africa, 54. It's not great, but it's relatively low, certainly compared to the United States and the United Kingdom. Now, Professor Shabir Madhi, he is a leading vaccinologist in Wits University. Now, he's talking about the Gauteng province, and there they think the cases have probably peaked. So the cases have gone up really remarkably quickly there, and it looks like they're actually starting to come down a little bit now in Gauteng area. So this is because it's very transmissible, so the cases go up very quickly. But then they can peak very quickly because they kind of bump in, if you like, bump onto herd immunity. So there's more transmissibility, so the cases increase very quickly. But because there's some community from immunity from prior infection, they stop going up. So we see a very rapid increase in cases, and hopefully we're going to see a very rapid decrease in cases as well. That's what it's looking like at the moment. And there's no reason why this should not be a very similar curve in the United States and the United Kingdom. So 3 to 4 weeks to the peak, down from 8 weeks in previous waves. So this is going to peak a lot quicker than previous alpha, beta, delta waves have peaked. So from this, it's likely we can expect peak cases in the United Kingdom in 3 to 4 weeks, which of course is about the first week in January. We can probably expect about 1 million cases per day by that time. Now, Professor Madhi went on to talk about the uncoupling of cases and uncoupling of cases and new cases from severe cases and death. So in other words, there's still plenty of cases, but less severe cases and less deaths. Now, as an example he used during the Delta wave, 20,000 reported cases per day translated into 250 to 300 deaths per day. That's now 10 times less. So per case, there's 10 times less deaths than Delta wave. Now, he does say Omicron's probably not less virulent. This is interesting. Omicron's probably not less virulent, but it's spreading because the conditions on the ground are very different, more community immunity. So what he's saying is Omicron might not be less virulent. It might cause just as severe disease, and we certainly know it spreads much quicker, but it's not expressing itself in severe disease because of the high levels of community immunity. And we've got these high levels of immunity in the United States and the United Kingdom. You know, that's great. But of course, many parts of Africa haven't. So is the Omicron variant going to spread rapidly throughout poorly vaccinated areas such as Africa? Yes. Is it going to cause a relatively high proportion of severe illness in those areas? It may well, because it may be just as virulent as Delta. So that's quite a sobering thought, that low vaccinated areas could be in for a lot of severe illness over the next weeks to months as Omicron spreads around the world. That is really quite concerning if the professor is correct there. So may well not be less virulent, which would be quite worrying. That the lower hospitalizations and deaths are caused by the immunity. Antibodies and T cells he then talked about. Omicron is antibody evasive, we know that, it gets around antibody. But T cytotoxic immunity is relatively well conserved. So these T lymphocytes that kill the virally infected cells, we expect that immunity to persist. And it's the antibodies that protect us against symptomatic disease very largely, and the T cells that protect us against severe disease, hospitalization and deaths. So it's the T cells that are an important one, and they are being preserved. This is what's causing the uncoupling between the cases and the hospitalizations and the deaths. And T cell immunity does come from infection and from vaccination. So it comes from infection and from vaccination. Of course, that's very important. Now, this is one thing I've actually been really quite concerned about, and I've expressed this worry a few times. The fact, my concern was that a lot of the immunity in South Africa is caused by prior exposure to actual infection rather than vaccination, whereas in the US and the UK, much more of the community immunity that we have is as a result of vaccination. So in Gauteng, serum survey showed 73% have been infected by the virus. So 73% of people have immunity from the active viral infection. And this has led to a lot of T-cell immunity, which of course we knew, but now the professor's saying that vaccines will provide T-cell immunity as well. So it's looking like the vaccine immunity that we are enjoying in the UK, for example, should protect us just as much as the partial vaccine immunity in South Africa and the actual real disease, real infection immunity in South Africa. So that is really quite a relief that that's based on the current South African data. So that gives us cause for optimism. Both natural infection and vaccination will protect against severe disease, because both will bring about the T cell response. The T lymphocytes, the T cytotoxic lymphocytes that will kill the virally infected cells. Now, I wanted to bring this data here, which is the most definitive data we have at the moment. Now, this is from Discovery, which is a South African health provider, insurer. And this is the data that they have provided here. This is the report. So you can go on this, look at it for yourself. It's all there. And this is the nearest thing we have to anything definitive at the moment. And I must say it is particularly well written. How so many news outlets, at least some of the world's leading newspapers, could take this very clearly written report and turn it into some of the gobbledygook articles I've been trying to make sense of is beyond me. If you go to that original, and of course I've included the link, it's actually much more transparent. I think a lot of the journalists that have been writing about this don't really understand the concepts they're talking about, so it ends up being very confusing. So much easier to go back to the original, which of course we've done, and I'm going to quickly run through it now. Now, this is data from the first 3 weeks of the Omicron-driven wave in South Africa. Okay, it's only the first 3 weeks that they're basing this data on. Data spanning clinical records, vaccination records, pathology results, doctors' reports, everything. 3.7 million people. Excellent. So this is a good study. Omicron, highly transmissible variant causing rapid community spread in South Africa. As we know, they confirm that. Fueling South Africa's fourth wave. So that is what's happening. Genomic surveillance, Omicron, over 90% of new infections now, as we've seen, displacing the Delta variant. Not as well as. We now no longer have the Delta variant, which is brilliant. The Omicron-driven fourth wave has a significantly steeper trajectory of new infections relative to prior waves. In other words, it's gone up really quickly. It's peaked in about 3 weeks, as we've seen, very, very quickly. But at least in Gauteng, starting to go down already. National data show an exponential increase in both new infections and test positivity rates. In other words, this is all over the community now, because, as we saw, was it 32% of tests are coming back positive, a very, very high positivity rate. Now, let's look at the vaccine effectiveness during the current Omicron wave. This is based on 211,000 positive tests, so it's a pretty good sample size. 41% from adult members who had received 2 doses of Pfizer vaccine. So that's what, it's about 100,000 people who'd received 2 doses of vaccine. So this is a good number from which to derive principles. 78,000 of these, 78,000 of the 211,000 of these COVID-19 test results were attributable to Omicron. So they've got basically 80,000 results from Omicron. They've got about 140,000 results from other variants. They've got plenty of data to do accurate comparisons between the two. So this is good. This is a good surveillance. To date, laboratory analysis has provided early insights into potential reduction in the effectiveness of neutralising antibodies against the Omicron variant, as we know, meaning people are more likely to get symptomatic disease. 2 doses of the Pfizer vaccine. Now, what they say is 2 doses of Pfizer-BioNTech vaccine provide significant protection against hospitalisation in individuals with the Omicron variant of infection. But because the antibody escape is there, they often get symptomatic infection, even though it's mild. So there's only a 33% protection against infection relative to the unvaccinated. So a good chance that someone will get some symptomatic infection. Only 33% protection. Bear in mind that was, with 2 doses of Pfizer vaccine, that was 80% protection. Now, I know in South Africa they've been using a lot of Johnson & Johnson Janssen vaccine, but when you have that and you give a second dose of Pfizer, which they have been doing, you get very comparable effects to having 2 doses of the Pfizer. So 2 doses of Pfizer and 1 dose of Johnson & Johnson followed by a dose of Pfizer is fairly comparable, fairly comparable results. So 33% protection with Omicron, down from 80% protection with Delta. 70% protection against hospitalisation, so still 70%. This is after 2 doses, remember, not after 3. This is after 2 doses, down from 93% with Delta, so definitely down quite a bit. But protection against infection, down more. Protection against severe disease, maintained to a greater extent. Protection against hospital admissions is maintained across all ages, so this is all ages are enjoying this benefit, and protection against admission is consistent across a range of chronic illnesses as well. Particularly, they found it was maintained in people with diabetes, high blood pressure, high blood cholesterol, and cardiovascular disease. So no particular group dropping out particularly there. The elderly over the age of 65 did have a slightly increased risk of reinfection and hospitalisation, but it wasn't significant. So reinfection, yeah, only 33% protection, but 2 doses, 70% protection against hospitalisation, which of course explains why the British government is going flat out to give everyone booster doses, because that will put that back up to over or to around about 90 or more percent, we believe. Reinfection risk. Omicron reinfection risk significantly high compared to prior variants, as we've just seen. Overall, the risk of reinfection following prior infection, so this is following not vaccination but following normal infection, natural infection has increased over time. So generally, people are more likely to get reinfected over time, partly due to the mutations and the changes in the variants, but also due to the normal waning of immunity. So reinfections are increasing over time. This has been continued, but more so with the Omicron wave. So infection with Delta, a 40% relative risk of reinfection with Omicron. So Delta's giving a 40% relative risk of reinfection. Infection with Beta, the previous South Africa strain, a 60% relative risk of reinfection, so a higher risk of reinfection. In other words, only a 40% protection. People infected with the first wave, which was a while ago now, the early 2020, 73% risk of reinfection. So we see that the longer ago it was, the greater the risk of reinfection, and the earlier variant, greater risk of reinfection than the Beta variant, greater risk of reinfection than the Delta variant. So they're the figures there: 40% with Delta, 40% risk of reinfection, 6% with Beta, 73% with the original wave. Now, severe disease. Risk of severe disease from this report. Risk of severe disease and hospitalisation is significantly lower in Omicron infection compared to prior variants. So that's good. This lesser severity could, however, be confounded by the high seroprevalence. So here they're agreeing with the professor we looked at the start, that it might not be the variant itself, it might be the fact that there's a lot of immunity already in the South African population. Risk of admission amongst adults diagnosed with Omicron, 29% lower. We'd hoped it'd be lower. We'd hope the protection would be higher than that, but it's 29% lower at the moment in South Africa. Hospitalised adults, lower propensity to be admitted to high care and intensive care units relative to prior waves. Okay, so less chance of being admitted. If you are admitted, much less chance of being admitted to higher levels of care. But as we saw, the overall levels of protection, the overall levels of hospitalisation in South Africa are still a lot lower than the United Kingdom and way lower than the United States. Right, last one on children. Preliminary observation on Omicron experience in children. Under 18 have a 20% higher risk of admission when infected with Omicron compared to Delta. So children are more likely to be admitted to hospital under the age of 18. Also increased admission in children under the age of 5, so this is higher than Delta. Is this a particular concern? Yes, it is. The relative risk is higher, but as we'll see, the absolute risk is not as bad, but children are more likely to be admitted to hospital than with previous waves. 20% higher under the age of 18. We don't have a precise figure for the under the age of 5, but we know it's higher. So this is a concern. Many are incidental discoveries in hospital, though. So most of these children are not admitted. The vast majority of these children are not admitted. So there's a lot of children coming into hospital with various things in South Africa at the moment. And many of them are found to be Omicron positive when admitted, but they were not admitted for Omicron complications. That is the reassuring thing about this data. So the risk to children is increased in terms of hospitalisation, but many of these hospitalisations, we don't have a precise figure on this, but many are incidental findings. We suspect it's around about 70 or 80%, or at least I do. But bear in mind, children were 51% less likely to test positive for COVID-19 relative to an adult. So children less likely to test positive in the first place, but if they are, there's slightly higher risk of being hospitalised. Now, when children did require admission, on the rarish occasions that they required admission, bronchiolitis, inflammation and blocking of the small airways, the bronchioles, pneumonia, inflammation and blockage of the filling up of the alveoli, and also, interestingly, severe gastrointestinal symptoms resulting in dehydration. So we need to look out for severe gastrointestinal symptoms in children that are poorly as well and consider Omicron as a possibility. Last bit of information for this video. The majority of children presented with mild disease with symptoms such as sore throat, nasal congestion, headache and fever that resolve within a few days. So the vast majority of children not getting sick, and most children that were hospitalised being incidental findings. So do check out that report for yourself. That's the most definitive information we have. It's pretty good, it's pretty clear. I would read that certainly in preference to some of the news coverage that I've been reading that's been very confusing in some of the newspapers, and indeed on some of the mainstream TV outlets. So check that one out for yourself. Where South Africa is now, the UK will be, and the United States and the rest of the world will follow, as we've said, unfortunately. But this does give quite a lot of a scope for optimism, especially as we're giving so many booster doses now in the United Kingdom, for example, which will further enhance immunity. Pity the authorities aren't talking about plenty of sleep. Pity they're not talking about vitamin D. Pity they're not talking about zinc. Pity they're not talking about other ways to improve immunity. But they've put all their eggs in the vaccine basket. But we do know that the vaccines are effective in protecting against infection, severe disease and hospitalisation. So that's the option that they are taking. Personally, I'd like both. Okay, thank you for watching.